Hello, and a very, very warm welcome to you all to our webinar today, How to Be a Sexual Woman with a Diagnosis of Multiple Sclerosis. I'm Nicola Graham. I'm your webinar facilitator for you today, and great to see so many women online across all of Australia, which is fantastic. So I won't go through the names, but just a big warm hello to you all. So just a reminder that this webinar is part of the Jean Hales Women's Health Week. So it's a national health week, as you probably know. So here are a reminder of the contact details for the MS organisations in the state that relates to you. So please reach out. You don't have to face MS alone. Reach out to the appropriate organisation by you if you ever need to. And if you would like to join some of the other Women's Health Week events, then you can have a look and head to events.msaustralia.org.au/WHW 2021, and you can get details of other women and MS related events happening throughout this week. So let's get started. Welcome everybody to today's webinar, How to Be a Sexual Woman with a Diagnosis of MS. Very, very fortunate today to have the fabulous Dr. Margaret Redelman and to have Nicole as our person living with MS to bring some real lived experience to the content today. So we like to start all of our programs with an acknowledgement to country. So in the spirit of reconciliation, MS Limited acknowledges the traditional custodians of country throughout Australia and their connection to land, sea and community. We pay our respects to their elders, past and present, and we extend that respect to all Aboriginal and Torres Strait Islander people today. So our wonderful presenters today, we've got Dr. Margaret Redelman. And Dr. Redelman works as a sex therapist and a relationship therapist in private practice. Her work covers positive male and female sexuality, sexual dysfunctions, and the interpersonal relationships of both heterosexual and homosexual couples. Many achievements for Margaret, too many to mention, but just to acknowledge a few of those. She's on the executive committee of SAS, the Society of Australian Sexologists. She's held multiple executive positions in the sexual health field, including, but not exhaustive, President of SAS New South Wales, President of the Asia Oceania Federation for Sexology, President of the 13th AOFS Conference, President of the 6th Sexual Dysfunction Conference. You get the gist. We're very lucky to have Margaret, and very blessed also to have Nicole with us today. And if I can use some of Nicole's words to introduce her, Nicole was diagnosed with relapsing remitting MS in '99 when she was just 19 years old. She says that in the first decade and a bit of her diagnosis, she worked full-time, happily single, didn't have any early visible signs or symptoms of MS, and she learned to hide it very well. In her early 30s, she met her now husband, and they've been together 12 years. So Nicole's got experience of life as a woman, single and in a long-term relationship, and she's going to bring some of that richness of experience to the webinar today. So she met her husband, and during that time she had a major relapse and was medically retired, so a huge change in her life, and her husband is now her carer. They've changed their lifestyle to a simpler life together. They've faced many challenges, as you can imagine, with Nicole's deteriorating mobility and changes in cognitive function. And that's, of course, impacted their relationship emotionally and physically. But she says she's really excited to be part of this webinar and to share some of her journey and to bring this topic out of what she says the darkness for women at all stages in their MS journey, and to provide some support and tools so that our listeners can manage this topic in a positive and proactive way. So wonderful. Thank you both for being here today. So I'm going to change presenters now. Margaret's in Sydney. I'm in Melbourne, and I'm going to get you to share your screen. Thanks, Margaret. That's wonderful. We can see that really clearly. And hand over to you.
Hello, everyone, and thank you so much for attending. I really love sharing the knowledge that I have. And to start us off, I'd just like to put forward some of the things that I believe in. So each of us is a sexual being, and that's from birth till death. I very much doubt that any of you left your sexuality behind when you came to this presentation. It's part of us. We can't leave it behind. Each of us is unique, both as a woman and as a woman with MS. There's no standardized, entitled, right sexual response. We're all slightly different. And changes occur throughout life for everyone in their sexuality. It's not a fixed entity. And these changes occur because of internal and external factors. And then on top of those changes, and sexual difficulties are a very common event for anyone, MS causes quite specific changes on top of those. But no two individuals with MS will have exactly the same outcomes because they're different people to start off with. And overwhelmingly, what's happening to you is not fair. So what I'm wanting from my presentation for you is that you can walk away with some ideas of the causation and how to improve, compensate, supplement, or reframe what is happening to you so you can work towards the best sexuality that you can have. That very much working from the glass is half full. What can I have? What can I do? What can I improve? Rather than it's not the same as it was, and this is what I've lost. So yes, you can be a sexual woman, and you can't not be a sexual woman because it's part of who you are. And you can have a sex life, but you do have to accept that it may look different from what you had before you were diagnosed with MS, and that's okay. Now, you all know the general changes that occur with MS, and it's about thinking, how can they affect sexuality? Because that gives you the framework of what you can change, what you can be in control of. So it's important to realize that sadness, depression, fear, anxiety, mood lability, all of these mental constructs change your ability to have erotic focus. Erotic focus, and I'll come back to this, is that ability to focus in on the sensual messages that you're getting from your body and your mind that tells your brain that you're in a sexual situation. To a large extent, nature doesn't want us to be sexual when we're not well, because from nature's point of view, sexuality is about reproduction. So the whole concept of sexuality as a recreational bonding activity is very much man-made. It's not natural. In fact, to a large extent, most of us have unnatural sex 99% of the time. Now, MS also changes your sensory perceptions so that the messages that you got used to listening to that led to sexual arousal are now higgledy-piggledy. They've changed, they're different. And it may be something like your sense of smell and taste. And most of us unconsciously like the smell of our lover. In fact, that's one of the ways we think that we discriminate. We choose one person over another because we like their erotic smell. So when your sense of smell changes, then you're not getting the cues that you were used to from before. Fatigue. You're all aware of how that impacts. And it's very hard to feel like wanting to jump through hoops when there's that deep, bone-deep lethargy that's occurring. The anxiety with visual problems, sleep disturbances. How can you feel sexy when you're tired? Temperature dysregulation, such a common thing that happens. And I'll talk a little bit about the sexual positions to use, but you know, that timing so that you can either have that cold shower or the cold swim in the ocean, putting the fans on, the temperature setting, so that you can manage that, because that temperature dysregulation does affect your desire to make love. Vertigo, not a great aphrodisiac. Headaches, The whole concept of mobility changes and how that affects your body image and your flexibility and your ability to move during lovemaking that may be so different. Of course, urinary and fecal incontinence aren't sexy, and it doesn't help your feelings of sexiness when you're anxious about them. One of the things we often forget is constipation also causes problems. That whole pelvic congestion and discomfort. You sort of don't want someone bouncing on your tummy or poking you if you know that's happening. And of course, pain, whether it's neuropathic, muscular, or skeletal. So these are all changes that do occur, and to be aware that they can affect sexuality, so that if you're not feeling sexy, it's not because you're crazy. There are reasons for that happening. And then sexual changes that can occur with the MS specifically, which are those libido changes, difficulty becoming aroused and having an orgasm, and the change in the orgasm, so that from being a pleasurable experience, it can become a kind of a mild nothing experience with a few twinges, or even to the degree where those uterine contractions can be unpleasant or painful. And that whole lack of sensation, so that women will describe themselves feeling like a tree trunk, so that you may know you're being touched, but there is no sense of enjoyment or pleasure or eroticism with that touch. The changes in vaginal lubrication and pelvic congestion that occur, so that penetrative sex or even digital masturbation can become irritating or unpleasant. And you may develop something called secondary vaginismus, where your pelvic muscles contract to protect you from penetration. So all of these things can happen. And all the time, it's about acknowledging that this is what's happening and why, and then what can I do about it? How can I make it better? How can I ameliorate it? What's available in the medical arena to help me with this? And there is a lot to help. And then, of course, there are the psychosocial consequences with MS that can affect sexuality, like your body image. Are you attractive? Will somebody else find you attractive? And your whole value as a woman, and what you offer as a sexual partner, what you offer as a family member, what you offer to society. So your whole self-esteem, how you view yourself, because eroticism and sexual energy does come from that energy. And if that energy is suppressed, then there's very little drive towards that sexuality. Nicole, what do you think about things that I've said so far?
Oh, thanks, Margaret. They're all so relevant. I have also experienced a lot of things on that list myself personally over 23 years of having MS, but I've also heard a lot from other peers my age and older. It's just something we're not comfortable talking about openly with people we don't know. And I think therefore a lot of women don't feel comfortable coming forward and asking for the help. It's really great that as you move through today, you're going to give some strategies in that to overcome some of these barriers, because I think for a lot of us, when things change with our MS, sometimes we do feel that hopelessness, that this isn't going to improve, it's only going to get worse. But having some lived experience and having had some barriers and challenges around sex and sexuality, I want women to know, and women with MS to know, that these things with patience and time and kindness to yourself can be overcome. Maybe not everything the way you think it will be, but definitely be open-minded to exploring how these barriers can be removed.
When you're talking, it makes me aware that there's so much more I want to say, but it's going to make this presentation too long if I say it all. But the reality is that most of us have zero or very poor sex education growing up. So that even if you had a perfectly blessed life, you're still likely to have difficulty talking about sex if something changes. So, you know, we've got a double handicap. We're not educated how to talk about sexuality, that it's a normal part of life.
Yeah.
Hence when changes occur, it's doubly difficult. So, just give yourself a pat on the back for saying, aren't I wonderful that I'm so brave that I can go to a friend, that I can go to a health professional or someone at the MS Society, or, make contact with someone to talk about this, because it does take courage to broach the subject. So, but I won't go too long into that, because otherwise I'll never get through what I want to share with you anyway. So often we think that if our sex life falls off the perch, why bother? And I think it's critically important to keep being sexual and to enjoy whatever sexuality you can, in the broad definition. And for me, sexual activity isn't penis and vagina. That's just one activity. And it is an activity that nature wants us to do to reproduce. But if you're having recreational sex, then it's not so important. Then I want you to think about all the other things that you can enjoy. And sexuality is important because you've already lost a lot with the disease. So don't lose your sexuality, because it helps you with self-esteem, with feeling normal, with feeling desired, loved, valued. And in the relationship, it creates bonding, goodwill, and peace at home. And I'm only just going to touch a little bit on relationship things and the partner, because I do think it's critically important that if you're in a relationship, there are two patients from my perspective, not just one. And, the partner's sexuality is often forgotten. So to keep that goodwill at home is critically important, because you also need that support. So this is part of how it goes around. The neurotransmitters and the hormones that are released during sexual activity, the oxytocin and the dopamine, will help you feel better, will help with pain, will help with depression. And you need that. You don't want to have any more losses. And in fact, what happens when you have a chronic health problem and sadness and depression is you tend to withdraw within yourself and withdraw from the partner. And we know that people who stop making love will stop kissing, cuddling, hugging, laughing together. And that's the last thing that you want when you've got a chronic health problem. You need to be caressed. You need to be kissed. You know how when a little child falls down and they hurt their knees and the mum comes along, gives them a hug and a kiss? That always makes the pain better. So if you've got problems in your life, health problems, life problems, you actually need more lovemaking, not less. And of course, sexual activity gives you genital and pelvic exercise. And I'll come back to that, because we forget that our genital organs need exercise. And, there's lots of research you can Google that will tell you that, having orgasms is great for depression. Having vaginal stimulation and orgasm increases pain threshold. And I could give you some wonderful examples there, but I won't spend time. There's been some research that even showed that semen in the vagina is mood enhancing and an antidepressant effect. So, there are lots of positive benefits to continuing making love. So it is worthwhile to persist and to be brave to talk about it and to seek help. Now, all of us, whichever culture you come from, there will be some negative sexual myths that operate. And if you don't acknowledge them, then you can't address them. And they do affect behavior very, very strongly. And there are subtle myths like sick people don't need to be sexual. Sex is only nice when the body's whole. For the partner, you shouldn't have sexual thoughts or feelings when your partner is ill. So, if one person has a health problem, it's supposed to affect the other person automatically. Doesn't work like that. Don't start what you can't finish. That sort of lovemaking. It's A to B in the most direct line, and you have to have intercourse and you have to have orgasms, otherwise you haven't done it. What absolute bunkum. if you think about it, whatever you've started doing, if that's been enjoyable, hasn't that had a value?
Mm.
So if you get interrupted, if your kid comes in the middle of the night asking for a drink and you're making love, does that mean that whatever you've done till then has been worthless? Of course not. So whatever you can do has a value. You know, that whole mythology about masturbation is bad. Masturbation is wonderful, absolutely wonderful. You have total control over your own body. You don't have to be sexually frustrated, and it's a wonderful adjunct to a relationship, especially if there are issues with intercourse the way it used to be done. So I'll come back to it, but masturbation is not bad. From a medical point of view, I don't know of any medical contraindication to masturbating. You can't get pregnant, you can't catch an STI, and it's much easier, in lots of ways than lovemaking. And of course, that old one, you shouldn't have to masturbate if you have a partner. You want to make love to your partner. They're not there to make sure that your sexual needs are met. So it's about reframing the way we think about these things and to realize that all of us are affected by this because we are brought up in societies that have these subtle and unsubtle myths. So, I've broken this talk into lumps, so I'm jumping on to the next one. And it's about conserving energy and sexual positions, because that's what we want to have. We want to be able to deal with that fatigue and tiredness. And a lot of you asked about, what are the sexual positions that will be useful. For me, the mind is the biggest sex organ. Our genitals are just end organs. And mind sex doesn't take very much energy at all. In fact, I've given talks to palliative care facilities about the sexuality of people who are in the terminal stages of their life, and I talk about mind sex. How loving and erotic is it to hold hands with your lover, to smile and look at each other's eyes and reminisce about the best sex you had sometime in your 20s. It's intimacy, it's eroticism, it's sharing. That's mind sex. Your mind is your biggest sex organ. So thinking about the way you view sex, it's about it being a recreational activity that's got to be fun. There's got to be variety there. You want to be responsible to yourself for meeting your quota of what you need to have that recreation and that fun. And you want to have control. And that's important when things are changing for you in your body. Outer course for me, as opposed to intercourse, is that very, very important other big concept in lovemaking. As I've mentioned before, we are focused on intercourse because that's from nature's point of view, that's the easiest way to become pregnant. But actually, outer course offers much more variety, which is what you want for recreational sexuality. So outer course is masturbation, manual stimulation, using vibrators, oral sex. It's all that activity that doesn't include intercourse. And it's much, much easier when the body is tired or sore or disabled in some way. And then I'll talk a little bit about toys. Outer course, infinite variety. So when couples come in to see me, for instance, and say, look, we're making love, there's nothing specifically wrong, and we have intercourse and we have orgasm, but it's just a bit boring. The first thing I say is, you've got to stop having intercourse. You've got to start thinking about what you're doing and making it an experience rather than a job to be done. And the benefit in outer course for women who have MS is that it's much less pressure on the weaker partner. You can take turns, for instance. So you can have a lovemaking session where only one of you is going to be aroused and have an orgasm. You can use different positions where you're not even touching each other except with a hand or tongue or a vibrator. So there's no pressure on you, and your positioning can be the most comfortable for you. You don't have to expend energy or thought on what your partner is experiencing, or you can take turns. It avoids a lot of the pain with the pelvis or with the vagina. It's much more restful. You're almost guaranteed to have an orgasm. Your hands are much more creative than the penis. The penis is really quite a stupid organ. It's just a little bit of skin with you know, some blood vessels inside that congest, but it doesn't see, doesn't think. It's actually not a very clever organ. The hands are wonderful in comparison, sensitive and reactive. Masturbation becomes a very important component here, whether it's self-masturbation or joint masturbation. And vibrators add a lot in terms of increasing stimulation and being able to last much longer than a human being can. So they provide increased stimulation for longer periods of time. Positions and timing. So very much being able to say, I used to love this before, but now it's not working for me. So that you have that support and the comfort. And then the last one I said was it has to be restable. So you are allowed to stop during lovemaking. It doesn't have to be the direct line from A to B. You haven't lost anything. As I've said before, anything you've done to date, which has been enjoyable, you're not going to take that away. And you can say, you know, I'm getting really tired now. Can we have a little break? And you can have just a cuddle, or you can have a drink, or you can have a cool shower, and you can come back again. Remember, you're having fun. You're not achieving a task. You don't have to get to anywhere. And it's so important to be cool. I have a dear friend's daughter, also a very young lady who's been diagnosed with MS, and she goes for a swim in the ocean every morning. Summer, winter, rain, hail, off she goes, because that's the way that she can maintain her body temperature. But you know, a cool shower is accessible to all of us, or even just a cool wipe down. And there are actually those wonderful synthetic cloths now that you just dampen and they keep you cool. So, you know, thinking about what I've got this difficulty, what can I do to make it better? And the timing. So it may be timing with medication. It can be morning or after rest time. Keep in mind that making love at night time is the worst time possible. Unless you're very young, it is actually the worst time. Hormone levels, the testosterone that drives a lot of the sexuality, is actually made in the early hours of the morning. So in the morning is often when you have the best hormonal levels for sexuality. But being in bed, being warm and snug and rested are really good times for making love. And nighttime, after being busy all day, is not a good time. And remember the air conditioning. So here are some positions, and what I've tried to do is just put some pictures up there where you can see that your body is exposed to the air, so that you can you know, keep your body temperature down a little bit. Positions where you're rested, so that the body is actually supported either lying down on the side, or you're actually sitting down so that you don't have to carry much weight, and that your mobility is free without having to push up on your partner. So the missionary position is often hard for women, because unless the man is very fit and keeps his body weight off, then you're actually squished, and that's really hard. So you're looking at positions which leave you exposed, which leave you supported, and still allow a lot of stimulation. What do you think about these, Nicole? Have you found anything that's particularly useful?
There's a lot in what you've just covered, Margaret, right from intimacy and outer course right through to actual intercourse. But yeah, I've definitely found as my MS has progressed over the years that I'm not 21 anymore, I'm 42, and things have changed along that line. And yes, my partner and I explore all different positions now, where we try not to get in a rut, and it depends on the day, the time. We actually plan time for sex so that I can prepare my body and mind the best way. I suffer from a lot of brain fog and cognitive fatigue, and I feel that interferes with my engagement and remaining present in a lovemaking situation. So for me, planning and timing is really important. And yes, because I feel I'm in a safe, secure and loved environment with my husband, we do explore these types of positions. And I think it's always good to note to keep a sense of humour. I'm a larger person, so not all of these work for me. So, it's about exploring what works best for you and your partner. And look, if it doesn't work, it doesn't matter. Have a giggle, and move on. So, yeah, I think that's really important.
What you've said is so true. It doesn't matter if it doesn't work. It's not like you're a one-stop hookup. You're an ongoing relationship. And what's intimate is that you've had to go together doing something new. You've had that shared experience, and that's intimacy. And if you can have a giggle with that, that's one of the most erotic things you can do. Laughter is so important. So it's not goal-directed.
And I think also when you rewind back to some of your first slides, across our relationship, we've had many hiatuses over the years with relapses on my part, or kids, or life, or just, in general. But we've always tried to maintain that intimacy. And it may be something simple like he'll walk past me in the kitchen and he'll give me a cheeky, on the bum, a cheeky tap on the bum, or he'll come up randomly and give me a kiss, on the cheek, and a hug. And it's in those moments where we weren't necessarily engaging in intercourse as regularly as we would have liked because of the situation and circumstances at that time, that I felt even more connected in our relationship. And I think that helped grow our bond, was removing that intercourse factor and the pressure of that, and exploring that and expressing that in different ways of intimacy, that a new relationship, I feel it lacked because it was so intercourse focused. But as you grow into the relationship, I found that those cheeky little things that make you feel loved and happy, and like when you first met and you couldn't keep your hands off each other, those things are really important. And still 12 years on, we still do that.
Yeah. That's that mind sex that I was referring to. And it's so important, when change is occurring, that you keep a baseline, a core baseline of sensuality and sexuality alive, even when you're not having, intercourse. And it's that holding hands, it's making sure the cuddle, it's the caress, it's keeping that connection, that intimacy, which is the mental sexuality that I was alluding to, so that when your body improves and the time becomes right, then you can go on to that physical sexuality. But if you let that sensuality die, it becomes really hard to jumpstart it again. That's really hard. So no matter what's happening, it's about being conscious about how important sexuality is, to keep that minimal baseline going, never letting that die. So this is sort of my strategy for how to cope with those times when you don't want to have sex. And it's about also that ability to say what I call a hard no or a soft no. Now, a hard no would be, I'm too tired, I don't want to do anything. Okay? Go away, don't bother me. A soft no would be, what do I have energy for? What can I do? What can I offer? And it's about the woman taking responsibility. It's on that left in the percentages. How much energy do I have right now? What could I do? Going from the glass is half full. If you've got zero energy, and people often laugh when I give this example, then what I would like you to do is to go up to your partner, give them a hug, and say, I really appreciate the compliment that you're giving me in wanting to make love with me, but I have no energy today, but I bought you a new, well, I'll say penthouse, showing my generation, but whatever that erotica is that you'd have, you know, I've got a new book for you. How about if you take, half an hour in the bedroom for yourself, and I'll sit down with a cup of tea and watch TV. Now, most people say, oh, that's a bit odd, encouraging your partner to masturbate. But this is where it's so necessary. Why should your partner be sexually frustrated? Why should they feel bad if they want to or need to masturbate? By sharing, by giving permission, by showing them that you've thought about them as a sexual being, and giving that encouragement for them to express themselves sexually, that is a real gift. That's intimacy. That's relationship intimacy. And no harm comes out of that. So you don't have to feel bad that you've deprived your partner and they're now sexually frustrated because you haven't got the energy and you've let them down and you're bad. You don't have to think that, because they're not going to be sexually frustrated. And it's been an intimate together activity which doesn't have any negative emotion coming along. Because when you have to fight or be bitter with each other about the changes in sexual activity, your mind remembers that bitterness for the next time you're going to make love. So you're accruing this negativity, which is unnecessary. Then moving along, if you have a little bit of energy, you don't want to swing from chandeliers for 2 hours. You're not negative or zero. So maybe you can say, I haven't got very much energy, but, I'd be happy for a cuddle, or how about if I hold you while you masturbate, or, something a little bit more. Maybe you'd be happy for a little bit more kissing, more engagement. Maybe you would masturbate your partner, or maybe you get a toy for them. But you still don't want sexual arousal yourself, or an orgasm, or to be touched genitally. A little bit more energy, maybe you wouldn't mind a little bit of caressing, but maybe you don't want intercourse. Maybe you want an orgasm. Maybe, you determine what a 34 or 30 to 40% energy level would mean for you. A little bit more energy, maybe you do want an orgasm. Maybe you want oral. Maybe you want him to masturbate you. Maybe you want him to use a toy on you. Maybe you want a very short intercourse. Maybe you're happy for him to have short intercourse with him having an orgasm, but you don't want an orgasm. There can be a range of responses. It's not a one size fits all. A bit more energy, maybe you'd be a bit more creative, more time, and so on. So to realize that there's a range of things that you can do depending on how much energy and comfort you've got, so that you're offering something. With a hard no, your partner gets zero, de nada. With all of these activities, they get something. And to me, none of these somethings are unpleasant. They're all enjoyable in their own right as their own unique activities. And you're getting variety. And people like variety in their sex lives. So these are all really good things if you can change the way that you think. So from that teenage time when you haven't done it, if you haven't had intercourse, give that a miss. That's not necessary. And you can have this lovely range of behavior, which is all loving, which is giving, which is sharing, which is intimate, which makes you feel special. And it makes your partner feel special as well. And it allows them to express their sexuality without fear that they're offending you or somehow they're a pervert because they want to have sex with someone, you know, who's got a chronic health problem. You know, it gets also muddled in a very negative way. It doesn't have to. What do you think, Nicole?
I love this table. I really think that's so usable. And it's almost like giving yourself permission to be guilt-free. I think through the hiatuses in our relationship, I've certainly carried a bit of guilt that I haven't been actively participating as much as I'd like to or want to. And my husband's had a few health scares as well over the last few years. So we've had a few hiatuses from both sides. And I love this table. I think that it really breaks it down into chunks. It's almost like, you know, those little things as kids you used to use, like, oh, which one are we going to pick today? I think it adds an element of fun. I think it takes away the guilt from the partner carrying the chronic illness. It's giving yourself permission to still enjoy or do something. I think in my 20s, I felt like a very selfish lover because I was single and I didn't have a long-term relationship. I carried some of that into my marriage because that was what I thought about sex and intercourse. But what I've learned is that all of this is very normal, very natural, very helpful, and it makes us feel good to give ourselves permission to not put the pressure. And I think that's what I felt with my MS, that there was pressure and expectation on me to still be this woman in her 20s that performs, you know, these elaborate, lengthy sex sessions. And I had to get myself out of that thinking. And I think this table, I wish I found it 20 years ago because I think it's wonderful in the variety it can give a relationship and the permission we can give ourselves to explore that.
Lovely. Okay. All right. Now, aphrodisiacs. And don't forget that men and women are different. So we you know, we have different things that we find positive and different things that turn us off. So talk about it. Make it fun so that you understand. So, you know, when your partner reaches for a porn video, don't necessarily be disgusted. You know, understand that men are more visual and that he may be using it to enhance his being with you. Men, on the other hand, need to understand that for many women, if they're not aroused already, porn looks silly. It's all these genital parts banging each other in no context. It just doesn't make sense. So it's about understanding that if you're in a heterosexual, this is a very heterosexist talk, you know, if you're in a heterosexual relationship, men and women think about aphrodisiacs differently, and we need to talk rather than just shut down our partner's aphrodisiacs. And if you're in a lesbian relationship, lesbian relationships also have the same difficulties as we've talked about. We hope that there is more ability to talk about it and to understand, but often when personal feelings get involved and we get afraid or offended or hurt, communication becomes difficult. So there's still that big pressure to talk about what do we like and what do we not like, and not to judge anybody else because these are individual preferences, but try to explore, perhaps sample from your partner's bag of aphrodisiacs, and if you like it, keep it, and if you don't use it again. Or maybe in trying something new, you'll discover a third entity that you actually like. But it's that including that variety. Don't close yourself in. Open the boundaries to explore possibilities. And this is what aphrodisiacs are. And it's a little bit, I think of it like if you're a tennis player, don't you want a new tennis racket every now and again? And this is, the way I think about it, that, nature, once you've reproduced and you're probably in your late 20s, 30s, nature doesn't care whether you ever have sex again or not because you're an old woman and it probably doesn't want you to reproduce. So, it's recreation. And the same way that you have other things that, whatever your hobby is, make it more interesting. You buy a new outfit or new colors or new paintbrushes or whatever. The same thing, you need to bring new things into your lovemaking. I can't imagine, well, our generation is very different. A few hundred years ago, people didn't live till 80 and 90, and they weren't in 50, 60-year relationships. So the concept of having this huge libido and eroticism, where you've been going to bed with the same person for 50 years and not varied anything, because you're still doing what worked for you the first time you had sex in your 20s or whatever, it just doesn't make sense. So think of it as a recreational activity. Think about the enhancers and the inhibitors, and have fun with exploring. Now, coming back to, from what I said a minute ago, having this wild horniness from nature's point of view doesn't make sense. So I would like all women past their 20s to not talk about, I have no desire. It makes sense to me that you don't have desire. But do you have willingness? And willingness is that intelligent, in that human thought. You're willing to make love with this partner because it makes sense to you, because he makes your life better. He adds value to your life. You chose him. He's making the family with you. You laugh together, you share together, you enjoy together. And that's willingness. So as long as there's no pain or coercion or unpleasantness with the lovemaking, it's about the willingness to participate in that activity. And that's what I think becomes very important for women to keep in mind. So that, I will see women come to me and say, I haven't got horniness. And I said, well, if you're a 40-year-old woman or a 50-year-old woman or a 60-year-old woman, that makes sense to me. But have you got a good enough relationship that it makes sense for you to make love with this person? That's what you've got to think about. That's the willingness. And with erotic focus, it's about also, in the broader sense, prioritizing your sexual activity because you understand what it gives to you. So in a way, if you've got a long list of things you've got to get through in the day with limited energy, and you've put sexual activity in pencil at the bottom of the list, how often are you going to get there? Not very often. So it's about prioritizing sexual activity because you understand what it gives you, your partner, and your relationship. Coming back to what I said at the beginning of the talk. And you've got to use your intellect. It's not something that hits you from the sky or a feeling or anything. It's a decision you make. You decide that you want to be sexual, that sexual activity is important for you, and you decide what you're going to do to prioritize it so that you keep a quota of energy and time available for it. You've got to work at it. We grow up in a society that somehow tells us that we should be sexual to a certain degree, and we start that in our teens or 20s, and then we expect that that should stay like that forever. And it doesn't, and then we're offended and hurt and upset about it. If you want to be a sexual person as the years go by, as the decades go by, then you've got to prioritize. You've got to make it important. You've got to do things to maintain your sexuality. And that's what that willingness and that prioritizing the importance of it and maintaining that erotic focus in your life, you choose to do that. It doesn't just happen. And you've got to so mindfulness is that concentrating on sensations you have when you're actually making love. You've also got reframe. So a lot of the negatives that you're feeling, you know, I'm not good enough, I'm not attractive, you have to reframe into positives. What I am able to do, what I do offer. If you don't know what you offer as your lover, as a lover to your partner, how do you expect them to feel good about making love with you? You have to hop into that bed with the attitude that you're the best thing since sliced bread. And when your lover touches you, he is so lucky to be able to touch you, that you have given him permission, that you want to let him into your life to share this experience. They are positives. And that energy that you radiate when you feel that, that translates into good lovemaking. Within that environment of variety and options that I keep harking on about. So, coming back to something very practical, if you're experiencing difficulties with arousal and orgasm, what do? Well, you do everything that I've spoken about so far, plus you've got to increase the stimulation intensity, the length of time it goes on for, and exploring different locations. Because for women, a spot that felt good yesterday might not feel good today. So you've got to explore around a little bit to find that focus of different or better stimulation. And the best way to do that is not through the penis, but actually with fingers, which are more sensitive and reactive. But even better than fingers are vibrators. And there are such beautiful vibrators that have been designed now for men and for women and for men, and I'll show you some for men in a few minutes, to be able to include them into your bedrooms. They're not something other or something strange, or there's nothing wrong with you for using vibrators. They're not just for the young people or for perverts. They're actually wonderful adjuncts to creating variety in your sexual enjoyment, and also for increasing that stimulation. Vibrators can give you stimulation the hand or the penis or the mouth can't. The other very important thing is lubrication, a girl's best friend. It's absolutely essential. As we get older, especially around menopause and post-menopause, lubrication is a little bit decreased, but more importantly, it's much slower. So it takes much longer in foreplay to reach the same level of lubrication. If you're having manual stimulation of dry labial tissue, or a vibrator or a toy rubbing dry labial tissue, you're going to get irritation and you're going to have discomfort. Not a great aphrodisiac. So using a lubricant from the very first genital contact is essential. And there's such a range of products available now. There's water-based lubricants, there are vaginal moisturizers, oils, silicone lubricants, to find what suits you. But just be very mindful, and also for your partner, if it's a man, to use a lubricant on the penis, because prolonged rubbing of dry skin is very irritating. So if you want to have prolonged foreplay, please remember the lubricants. So I've got a little picture here of kind of toys that you can use. And up here, I don't know if you can see the pointer, but it's called the Wee Vibe, which I think is very cute. It goes into the vagina, and the penis goes into the vagina as well. So both of you are getting that internal stimulation. There are little vibrators here which have a suction on the clitoris, which is interesting, and little balls you can put in the vagina. And can't even see now what this one is. Anyway, the lubricants. I've got macadamia oil here. Don't forget that most of the lubricants do not taste very good. I don't care, the raspberry flavored, strawberry flavors, banana flavored, they don't taste very good. I happen to like macadamians. So macadamia oil is actually a very nice lubricant, and it actually tastes good and smells good. These are the vaginal moisturizers. Now, don't forget that the vagina needs exercising. That's not something we're taught. And especially post-menopause, the vagina will shrink unless it's exercised. So the vagina actually needs to be stretched and widened regularly to maintain its pliability. If you're postmenopausal and you're trying to have intercourse once a month, I can guarantee you're going to be uncomfortable. So having something like a dildo, and you visit your vagina a few times a week, will keep the vagina pliable and make that penetration, if that's the problem, pain-free. So exercise is very important, and I'll come to pelvic floor exercises in a minute as well. Now, I've put 3 male toys here, because if I'm talking to women and you're heterosexual, then you've got a male partner. And there are some lovely toys that have been designed for men now. The very simplest one is this bottom one, which is just a gelatinous, it's called a sleeve. It's got a space down the center there. You lubricate the penis and you put the sleeve over the penis, and it gives you a lovely soft silicone structure to hold in your hand and to masturbate your partner with. Now, I recommend this to women who, for instance, have arthritis in their hands or have weak hand muscles, because it makes it much easier to masturbate the penis with greater comfort for yourself. And I haven't had a male patient yet who hasn't liked it. It's very cheap, it's easy to use, and it gives a little bit of variety and a little bit of rest for the woman. Now, this little black tube here, I haven't tried that one myself, but it's advertised that it blows hot air, and which I thought was fascinating. Can you imagine surprising your lover with this little toy? You know, you get them to lie down, you perhaps put a blindfold on them, and then you put this little toy and it blows hot air on their penis. I would think that most men would love that. And this, the little blue one on the top is a lovely aesthetic design for a male vibrating tool. So you lubricate the penis up, and you can imagine you put the penis into that curve, and you move it up and down the penis. So once again, if you're tired, if you don't have much energy, to use a little vibrating tool like this on the penis, your lover will love it. And it's very low cost to you. So you've been a wonderful partner. They've had a lot of fun. Everyone's enjoyed themselves. You know, it's
Margaret,
what
as you were mentioning the hot air blowing toy, I was just thinking, now I've finally worked out how I can get my bins taken out every week and the washing up done. The perfect incentive.
Remember, I said goodwill in the relationship. Making love, as far as I can understand it, is a lubricant. If we're making love and we're intimate and it's good enough, then it helps us tolerate all the times we step on each other's toes. It makes us much nicer to each other and much more willing to do things. So yes, I agree with you. No, but now the pelvic floor exercise that I mentioned. So as human beings, we walk upright, and we have this, sling kind of setup of muscles to hold all our insides in our abdominal cavity. But as we get older, these muscles get weaker. We have children that stretches them to bilio. Then, we have neurological problems as well. So these muscles get weaker. And in terms of sexuality, that's very important because sexual arousal is actually a build-up in tension in this pelvic floor, and an orgasm is actually contraction of those muscles. So if those muscles are too weak, it's actually very hard to become aroused and to have an orgasm. Or the orgasms, instead of being strong contractions, become very weak kind of movements. So pelvic floor exercises to strengthen these muscles are, I think, a must for every woman who wants to have a good sex life. Whether you have MS or not, that's irrelevant. But of course, having healthier pelvic floor muscles helps with urinary incontinence as well. So, and it's a lovely creative way to massage the penis during intercourse. Most men seem to like that. So there's no downside to this. Exercising your pelvic floor muscles is cheap. You can do it anytime. It's pain-free. You just have to do it. And I would recommend 120 contractions a day, 5 lots of 20 quick ones, 20 slow ones. There are lots of different combinations and programs. Pelvic floor physios, all seem to make up their own routines. Just Google it. The most important thing is to do it every day for the rest of your life. It's like brushing your teeth. If you want to have healthy teeth, you brush your teeth every day. You want to have healthy pelvic floor muscles, you exercise them every day. But it is such an important thing for having good orgasms and for being continent for women. So that's something I would recommend very much for everyone. Just a little mention about medication. Many of you will be on antidepressants to help with that sadness and depression. Now, if you're depressed, then going on an antidepressant will sometimes release your libido, because as your depression gets better, you get more energy and more interest in making love. For some women, the medication itself lowers libido. So you need to mention this to your psychiatrist or GP, because not all antidepressants are the same in the sexual side effects that they have. And there are the novel antidepressants that have low or no sexual side effects that may be very useful for you to change to. But don't stop your antidepressants if you need them because of the side effect. Go and talk to someone about it to get something that's more helpful. We've talked about, menopause as a little bit. So whether you're on hormone replacement therapy plus or minus testosterone to help sexuality. If you've got a dry vagina because you're postmenopausal, then the topical estrogen creams can be helpful. Even the PD5s, the Viagra and Cialis that men use very, very successfully, I might say, can be helpful for women. But once again, you need to talk this with your talk this over with your health professional, and you might give it a trial to see how it works. And flibanserin was the pink Viagra, but of course we don't have that in Australia. But there are many medications that have a negative side effect on sexuality, and if you're experiencing this, mention it to your health professional. Don't forget that many doctors have problems talking about sex. So you're important to yourself don't let anyone else put you off. If you've got a question or an issue with sexuality, barge along and, you know, make the health professional help you. And if they don't, go to another one. Oh, before we go on, anything you want to add to those things, Nicole? Have you had any experience with any of those? No?
Yeah, some of the clinical depression medications at certain points with relapse I've taken, and yeah, it does take the edge off the feeling, but it's so complex during that time with a relapse that, you know, intercourse or being intimate with your partner is the last thing on your mind. It's unfortunately penciled in at the bottom of the priority list. But, you know, I think yes, yes, and yes. I think having these conversations about vibrators and oils and all these things sensual, I come from a fairly conservative family, so this sort of stuff was never discussed in my teenage years, and then I became an adult and moved out. So I think it's great that we can have these conversations and start these discussions and normalize it, because I grew up in a family that was very, you don't talk about those things and you don't visit those adult stores for those naughty toys. So I think it's about finding ourselves as adults and working out and accepting and being open to what's normal in your relationship and what you're comfortable in exploring. And I think it's also helpful. It's been so informative and so educational. I have a little bit of a pep in my step, I think, Margaret. Oh, it's exciting. I just think it's exciting and an exciting conversation to have.
Okay. All right. So coming back, you know, if you're in a relationship, there are two people. And once again, you know, don't forget that your partner may be having sexual difficulties of their own, quite independent from what's happening to you. But coming back to the MS, you know, some people cannot cope with the diagnosis of a chronic illness like MS and the consequences this had. And, you know, it's really sad, but has to be accepted and dealt with. That the partner may be overwhelmed. And they also need the opportunity to be able to talk with someone about this to find a way forward. If you're single, you know, when and how do you share with a new partner what's happening to you? You don't want to make yourself vulnerable and over-disclose to someone who's not interested, and it's just a casual situation. But you also don't want to set up a scenario where you're not getting your needs met or you're suppressing issues for yourself, and you're starting off on a mistruth of what's going on. So it's a very you know, a difficult situation of when you share, when do you, because in a new relationship you don't know someone, you can't trust them. That's it's an erroneous feeling if you trust someone new. So how much of yourself do you disclose and make vulnerable? It's a case-by-case scenario. And the only thing I can say is to go slowly and to protect yourself all the time. I'll give a little example of how to communicate a new situation or a change situation. But that scenario of when you're single is a difficult one, because I've seen situations where the couple has grown into an established relationship, but many of the things that were causing a problem from the very beginning have never been addressed. And then you can't enjoy your sexuality. So you do have to be brave, and you do have to insist that your basic needs are addressed, whether it's that you don't get aroused in 10 minutes, that you do actually need 20 or 30 minutes of foreplay, that whether it's that you actually do need a vibrator to actually reach an orgasm in the relationship, otherwise that you don't, whether it's that you know, you can't sustain the missionary position if he doesn't support his weight off your pelvis or off your thighs, whatever it is that's important for you to enjoy your sexuality, those core things have to be addressed. And if it means that he can't cope with that, then you're probably better off without him. And you might as well find that out early, where you're not so invested, than later on. And I know that sounds really harsh, but to keep a relationship by suppressing yourself and not getting your own sensual sexual needs met, I don't think that leads to a good outcome in the long run. So what can happen in a relationship as the MS is diagnosed and progresses? Well, the most common thing I see, whether you have MS or not, is desire discrepancy. So desire discrepancy is when, you know, your desires don't match and one person wants less or one person wants more than the other. And I call that actually normal. I can't imagine a 50-year monogamous relationship between two people having synchronous desire the whole time. So desire discrepancy is a normal thing that happens over the course of a relationship. Sometimes the partner who wanted sex more at the beginning ends up being the partner who wants sex less, and vice versa. So the quality of the relationship is actually shown when the couple can negotiate that, when they can bring to the table what's happening to them and then find a solution which is going to be good enough for both of them. So it's a negotiated solution, which means that nobody gets exactly what they want. So the usual situation is where the partner who wanted more gets a bit less, but it's complemented and compensated and addressed so that it's good enough. And the partner who wanted less puts themselves out a little bit more in ways that is sustainable for them for the long haul, not just the short haul, so that both people can be happy enough. So it's about that negotiating process. But that is the commonest thing that I see. There's the guilt over not meeting a partner's needs, which I think is very corrosive and needs to be dealt with. And can we have sex and make love if not orgasmic? These are very common things. So that if I'm no longer orgasmic, is it worthwhile having sex? Well, I'm hoping that you say yes, it is, from what I've said already, because making love and having sex are two different things, actually. And I would like all of you to be making love and not just having sex. And orgasm is a very nice endpoint to reach, but lovemaking can be extremely enjoyable and very nurturing and sustaining without that orgasm as well. So my 3-point communication rule for sharing difficult issues. And any of you who've done any communication things, so this is just sometimes called the sandwich model. 3 points. So say something nice or encouraging, understanding or empathic to the person, so that you're showing them that you're also acknowledging them, that they're important to you. Don't forget, when you're anxious about something or are going to say something that you think the other person doesn't want to hear, your body language gives you away before you've even opened your mouth, unless you have an Oscar hiding under your bed, because our body language says that we're anxious. And the partner sees this and they say, something unpleasant is going to be coming my way. So they put up a barricade to protect themselves. So already they're not hearing you clearly. So to engage your partner, if you can say something good to them about them, it usually lowers the barricade a little bit so they can hear you better. The next step is to say what's happening for yourself using the first person I language. So in this model, you are not allowed to say you or we. You're talking about yourself. You're sharing yourself. Now, even if the partner doesn't like what you're saying, you have a 1000% right to have an opinion about yourself, the way you think, about the way you feel, and what you want. No one can tell you you're wrong for feeling the way you feel. Most people do not like to be told how they are. That's when people become defensive. So this second bit is I call your information giving bit. You're laying out a buffet of your thoughts and feelings, which you've had in your head because you've usually thought about this situation for a while and you know why you think the way you feel. But the chances are you're just giving your partner the conclusion and they have no idea how you got to that. Now, the third step has two possible steps in it. The first step would be you tell them what you would want to happen to improve the situation for you. You're not trying to solve it for them, you're trying to solve it for yourself. So if you're having a relationship with another adult, it's about there being enough respect between the two of you that you trust him to look after himself, you trust you to look after yourself, and both of you respect each other enough that you will try to meet each other's needs. But you as the adult have the responsibility to come up with the solutions to make yourself feel better. It's not fair to go up to your partner and say, I'm unhappy, and then silently wait for them to fix it for you. It's your job to go up to your partner and say, I'm unhappy, and I'd really love it if you could give me a hug right now. You have the responsibility to at least initiate what's going to make it better for you. Now, if you find that your partner doesn't listen to you or the solution keeps falling off the perch, then you might bring in a consequence. I usually use a very simple sexual scenario here. So I'll just say that. So say, for instance, your partner rubs your clitoris from right to left. And that's becomes sore for you. You don't like that. It's not erotic. It's unpleasant. So you might say something like, I love making love with you, but when my clitoris is rubbed from right to left, I get sore. And I'm really wondering if it could be rubbed from left to right to see if it could make it more enjoyable for me. Would you be able to do that? Okay. I mean, I imagine any lover any of you have would automatically say, of course, dear, I'm sorry it's been sore for you. You know, of course I'll rub from left to right. But for, you know, he's been doing it from right to left for many years now. So for him, it's normal. That's his first default position. So after a couple of months, it goes back to the old way of doing, and it's sore for you. So you'll say it again, and you'll say, of course, I'll make an effort. But it falls off the perch again. So then you might say a consequence. And the consequence would go something like, I love having you as my lover, but when my clitoris is rubbed from right to left, I get sore. And I'm really worried that if it continues to be sore, then I may not want to make love. That's a consequence, which your partner may not have realized the significance of what continuing the activity would mean for you. So it's about keeping things very simple. It's about not blaming. There's no you or we in this equation. It's about giving information about yourself to make things better for you. And, it may take a little bit of practice, and it's very important to keep the first step in place, because usually when we become anxious, we go in straight for the attack or for justifying ourselves. And usually that doesn't end up so well. It doesn't give us quite the solution we want. So it's very important to be able to say no, but it's soft. So it's not no, go away. I don't want to make love. I never want to make a love again. You know, you're a terrible lover. I'm sore. God, you're inconsiderate. How could you possibly want to make love to me when I'm so tired? It's none of those kind of negative based things. It's about seeing the compliment that you're being given and then thinking about what you can do, what the options are. So it's being able to empower yourself enough to be able to negotiate for the level of sexual engagement that you want. But to do that, you need to know what you do want, what you're able to offer, what you're able to ask for. The bottom line is you need to feel that you're entitled to be loved and you're entitled to have good sex. And, you know, once again, you know, I think from nature's point of view, it's not a given. But as a woman living in Australia in 2021, I very much believe that you are entitled to be loved and you are entitled to have the best sex that you are able to have. And you need to believe that too and work for that. So in order to perhaps get to where you want to go to, you do need help quite often. As I've said, most Australians have a very poor sex education. Our parents didn't have it, so they didn't have to teach us. In school, we mainly taught how not to get pregnant and not to get an STI, which is quite the sexuality. You know, I don't think anyone actually teaches you, you know, how to have the best orgasm possible. You know, so we don't have the practical stuff that we want. So get help. The MS Society is there. They also have a library and they have social workers that will help you. The internet offers advice, although you have to use a little bit of discretion there. Your GP or other health professionals are there. It can be hit and miss because not all are either educated or trained in sexuality or comfortable with sexuality, because they're just people too. And I often think that, you know, as doctors, we're the nerdy ones who probably didn't have a big sex life of our own, so we're not terribly comfortable with it. And then always remember that you're as entitled as anybody else to have a good sex life, but you have to work for it. And sometimes that's hard, but it's worthwhile. And now the Gin Health Foundation is a wonderful source of information for women, especially around good sexual health and good sexuality. And then my sex organisation, which is the Society of Australian Sexologists, we've got a website, and you know, more and more the health professionals are being trained with sexology information and getting accredited through the society. And you know, you can find the people who are accredited on the website to get help from them. So never give up. Remember that you're sexual from the day that you're born to the day that you die, but it's not an entitlement. You have to work for it. So yes, you can be a sexual woman and enjoy a good sex life, no matter what. Thank you very much for being a wonderful audience.
Thank you so much, Margaret and Nicole. I think I sat through the presentation with a big smile on my face so many times, and I could see Nicole the same. I have got a couple of questions, and I am interested, Nicole, any comments from you as well? So
I feel reinvigorated. Thank you, Margaret. I think it's something we don't talk often enough about or open enough about. And I do think that communication, I think as we mature and age, becomes a little easier to navigate with the right people in the right circumstances. And I wasn't very forward in communicating my needs in my 20s, and a little embarrassed perhaps at times to ask for what I felt I needed, which made things really difficult in my journey with finding a long-term partner. That was a real struggle for me from that 19 through to 30 odd. Yeah, it wasn't a pleasant time. but I made it and I found a partner. And now I don't know whether it's maturity or if it's safety in the relationship, that feeling of comfort and desire and the intimacy that we have. But I'm able to communicate my needs much better these days in a more non-apologetic manner. I don't see my MS as a weakness. In some ways, I think there's some strengths to it. As I said, with some of the hiatuses, it has brought us closer in a communication way, in a bonding way, which has enhanced our intimacy and our outer and intercourse. So I think, you know, there can be positives and silver linings through struggle. And I think it's always important to keep a sense of humour, because we laugh a lot, and laughing, I think, sometimes makes you feel just as good as a good old roll in hay.
Absolutely. And we had lots of questions sent in, and Margaret's covered, and between yourself, Nicole, and Margaret, you've covered lots of them. But there is one question that I would like to bring up, which is about sex and incontinence, which can be an issue for lots of women post-menopausally, but post-childbirth, and obviously women with MS can be a real issue. Any tips there around sex and
Nicola,
continence?
can I close the slide down so I can see you?
I'm not sure, Margaret. Yes,
Okay,
you can,
right.
because we're not sharing your screen anymore, so you can absolutely close your PowerPoint, 'cause we've got my screen showing now. So you can do whatever you like with your computer, and nobody can see.
I think urinary incontinence is a very common thing for women as they get older and post-childbirth and post-menopause. And one of the things I stress that unless you've got a urinary tract infection, urine is actually just a sterile biological fluid. So that, you know, it's once again reframing what's happening, because if you're not able to strengthen your pelvic floor muscles enough to help with that continence, and you're not suitable for surgery or it hasn't been successful, then it's about learning to live with that and to have a sense of humor about it. So, you know, get the cot liners, put pretty ribbons around it, put satin there, you know, make it fun, incorporate it. It's not going to damage anyone, a little bit of warm liquid there. And the same for women who ejaculate with orgasm. You know, they're often try to suppress their orgasms because they're embarrassed by the fluid that's released, you know. And it's about just letting go, enjoying the experience, and tidying up afterwards, having a shower together, continuing that intimacy and just accepting it. Of course, you know, going to the bathroom before you hop into bed or wherever you're going to make love is always a good idea. You know, to just at the volume. But otherwise, it's about reframing it. Just okay, this is how it is, and letting go of the embarrassment about that. Enjoy yourself.
And thank you, Margaret.
Shaking her head, agreeing.
Yeah, look, that was an icky topic to discuss when that sort of first happens. I have retention rather than urgency, but I still get concerned in the moments of letting yourself go that things may go haywire. So we have a king bed, so washing king sheets every time is it's just incomprehensible. So we use towels. There's nothing wrong. It's easier to wash a towel than a bed full of sheets. So yeah, it's just become the norm.
Yeah. So I would use the cot liners, you know, for children. Okay. You know, because then, you know, the sheets and the mattress and everything else is protected. Yeah, and they're easy enough. You know, the size, they're easy enough to wash.
And Margaret, because we've got you on the line and we really want to enjoy the benefit of your expertise, I've got two questions that were sent in that are not really MS related, but I think they're really, really interesting for women generally. And so one was, is there a difference between vaginal and clitoral orgasms? Can you talk a little bit about that, please?
Oh, that's a very old one. So basically,
a bit Freudian, isn't it?
If you think about the clitoris is the penis in a man, and the vagina is the scrotum. So how many men can have orgasms through caressing of the scrotum? You know, it's so the clitoris is actually the main focus for sensation. I suspect that the women who, and there are, roughly we throw this figure around, nobody knows exactly, about 30% of women can have vaginal orgasms without direct clitoral stimulation, which means that, you know, 70% can't. I suspect that the women who have vaginal orgasms, and they may not necessarily have vaginal orgasm with every male partner they have, it's a certain alignment that gets the way their nerves are distributed over their pubic bone and through the clitoris. It just gets that plexus of nerves, which gives them the arousal. So in terms of the input of stimulation that you're getting, most women will find it easiest for direct clitoral stimulation. But the alignment between the woman and her partner for some women is such that they actually get a lot of clitoral stimulation with intercourse, just the positioning of where the two bodies are. And if they've got a lower threshold for arousal, they need less stimulation to get there. So women with a high threshold won't get enough stimulation through that minimal stimulation with intercourse, and they need the more direct. Mm-hmm. Is one better than the other? I think the outcome is the same in the body. So the same thing happens whichever way you get your orgasm, your hand, his hand, a vibrator, a penis, a tongue, the sequences that your body goes through are exactly the same, with ultimately tension in the pelvic floor muscles with the contractions, which are the orgasms you perceive. So that's the same. What women will say that their emotional response is different. So that they might feel, if you value orgasms through intercourse, then you attribute a higher value to having an orgasm that way, which is then a different experience, because the other one is a lesser experience. So it's that subjective value that you give to it. But I think in the body, the same thing happens.
Mm-hmm. Okay. That brought up another question as well, is if you start to use a vibrator in the bedroom, are you going to become dependent on that? Does that mean if you then don't use the vibrator, that things won't be as stimulating and won't be as arousing? So are you setting up a dependency?
You could be. That's the worst case scenario. You could be, because we're all habit-making individuals, all right? But the thing with using a vibrator is that no matter how good the vibrator is, it doesn't kiss and cuddle you and tell you you're wonderful. Okay, so it's what you value. So what we all have is we have a threshold at which we reach orgasm, and you reach that threshold through two ways: your mental stimulation and the values you attribute to what you're doing, and the body stimulation that you're getting. So in theory, it's possible to clamp a vibrator on your clitoris, think of putting out the garbage, and reach an orgasm. And it's possible to have a very erotic dream, not touch your genitals at all, and have an orgasm, which would be like a dream orgasm. Okay? And most of us want something in the middle. So we use a vibrator either to learn to have orgasms at the beginning or to help ourselves reach orgasms quicker. And yes, you can develop a habit that your body's used to that kind of stimulation. But you can, if you include the mental stimulation of a new partner or a loving partner or a new scenario, then you need less stimulation. So then, you know, the body stimulation of your partner masturbating you or intercourse might be enough. So I think most of us want the ease and convenience of a vibrator, but also that emotional stimulation. So we will work towards, you know, getting both needs met.
Mm-hmm.
That answer your question. So yes, you can become fixed on that kind of stimulation, but most of us can navigate including the other a bit more into our relationships.
Okay, beautiful. And thank you. That's covered so much, and as ever, really rich information. Nicole, anything that you'd like to add before I end the webinar?
I just want to thank you, Nicola, and you, Margaret. I think this is such a great topic of conversation, and I think now the conversation started, let's keep having them. I think they're very helpful, and I think it breaks down those barriers and those stereotypes of how we grew up with lack of sex education and asking for what we want and playing with toys and all those no-nos we were told weren't good for us. So I think it's really helpful. And I'm just really grateful to be part of this today. I've learned a lot. So thanks, Margaret.
And I've learned a lot too. And can I just say, I've left with a list. So big thanks. I'm just going to quickly close with a couple of housekeeping for our listeners, and that's just a reminder that there's many services that Multiple Sclerosis Limited delivers for you: peer support, NDIS, employment support, education, allied health, to name just a few. Lots of resources for you. We've got a wonderful podcast series and a lovely podcast with Margaret as well that you can listen to when you're driving or whenever's convenient. Huge webinar library, online events via Facebook. We've got our In Touch newsletter. And if you'd like more information or support from us, then please contact us via MS Connect, our gateway to all of our services, which is 1800 042 138. So thanks very much for listening, and look forward to seeing you all next time.